Sculptra, let's talk about it. Sculptra is an injectable treatment that contains something called PLLA, which stands for poly-L-lactic acid. It's actually been on the market for around 25 years, but we've recently just introduced it to clinic. What does Sculptra do? 1. It restores facial volume. 2. It improves fine lines and wrinkles. 3. It improves skin quality and thickness. And 4. It provides a subtle lifting effect. Now you might be thinking, hold on, that sounds just like dermal fillers. But wait, let me explain the difference. With hyaluronic acid fillers, these are much better for treating very specific areas of the face, such as the delicate tear trough area, enhancing the shape of the nose, restoring lip volume, treating nasolabial and marionette lines, and lastly, also improving contour to the cheekbones and jawline. However, Sculptra has a more widespread effect on the face and is much more effective for restoring volume in large areas. So the ideal candidate for Sculptra is typically someone who's a little bit older, typically someone 40 years and above, who has volume loss in multiple compartments of the face. For example, they may have temple volume loss in the preauricular area, so it's this area just in front of the ear, below the cheekbone, and also sagginess or droopiness in the lower face. Because Sculptra is injected in a broader area, it has a much more widespread effect on the face. It partially behaves like a dermal filler to restore volume, but this time it's stimulating your own body to produce collagen, and it partially behaves like a skin booster to tighten and improve your skin quality. So in summary, what are the main differences? With fillers, it's an immediate effect. With Sculptra, it's more gradual. Fillers are much better for restoring volume to certain areas of the face and contouring, whereas Sculptra is much better for restoring volume in a large area. Fillers are reversible, whereas Sculptra is non-reversible. Now, another question you may be asking is, how does Sculptra compare to skin boosters such as Profhilo, Sunekos, polynucleotides? Well, skin boosters are much better for mild skin laxity and fine lines, whereas if you have more advanced signs of aging, Sculptra is going to be much better because it will more aggressively stimulate collagen.